I'm Spence Pentland from ChineseMedicineTools.com, and I am here with Misha Cohen. How are you today, Misha?
I'm doing pretty well.
Excellent. We were talking in the lobby before, and there's some interesting history that seems to be playing out. We're at the AAAOM conference in Chicago, Illinois. First, maybe just tell us a little bit about your practice for those out there who aren't sure who you are yet.
Alrighty. Well, I'm a doctor of Oriental medicine and a licensed acupuncturist, and I've been practicing for a little over 33 years now. And my practice primarily is related to such issues as hepatitis C, viral issues associated with cancer. HIV is something that I've been doing work with since before HIV was HIV. And but my doctor was in gynecology, so I actually have a lot of experience and practice in gynecology. And one of my biggest interests is research, particularly herbal research.
Herbal research. And you were speaking before a little bit about virus and liver health. Can you expand on that a little bit?
Well, one of the things is from the very beginning of when I practiced, which began at Lincoln Detox in the South Bronx in New York City, many people had hepatitis. And at that time, of course, we knew that it was hepatitis B, and certainly people knew they had hepatitis A. But I know now that I was treating many people that had hepatitis C because it's been around in the population for a long time. And many of the people with hepatitis have very, very serious health problems. They don't know they have hepatitis. Actually, one of my goals in life is to help people understand how many people actually have hepatitis C. Many of the people who have chronic fatigue or who have digestive disorders have hepatitis C. And there's, in the United States at least, there's about 5.5 million people. I know Canada has a huge number of people with hepatitis C, particularly in the BC area.
That are undiagnosed?
Undiagnosed, yeah. About 2/3 to 3/4 of the people who have hepatitis C don't know they have hepatitis C.
Okay, so those are the main signs to look for, obviously.
Well, some of the main signs, yeah, and then people can have it for 25 to 35 years without knowing, then all of a sudden start having illnesses which might be associated with having liver damage or cirrhosis, that type of thing.
Okay.
Yeah.
So you bring them through, you want to do research on this kind of thing. So are you testing liver enzymes? Do you have a TCM approach? Do you want to explain a bit about your research?
Well, the kind of research I do has been involved with viral illnesses overall. I started with HIV many, many years ago, working at the University of California in San Francisco with doctors studying herbal medicine for HIV. But we look at a lot of different things. It really depends on the particular herbal, it depends on the particular disease. And I'm a Chinese medicine practitioner, so I primarily approach it from the perspective of Chinese medicine. However, what Chinese medicine is very, very broad. I think of it as the philosophical basis of Chinese medicine, and that we can bring in as much of Western medicine as we can, as long as we can explain it from a Chinese medicine perspective.
True integration.
Yeah, and I think we have the advantage oftentimes because we have a broad system that can incorporate Western medicine. Western medicine is very compartmentalized, and it's very difficult for Western medicine to actually bring Chinese medicine in its full form. But we can bring Western medicine in.
Sure, we're holistic.
Yeah, and it's very interesting how that works. So when I work with a person with hepatitis C and they come in, first place, many times their doctors really don't know that much about hepatitis C, so I'm often explaining from I'm the specialist, and I'm explaining from the Western perspective, but also helping them to understand that there's a whole process that they need to be dealing with, not just hepatitis C, but they might have liver qi stagnation or toxic heat or spleen and stomach disorders from a Chinese medicine perspective, and we would be using herbs and acupuncture and dietary therapy and exercise according to their specific diagnosis.
So do you teach anywhere? Are you putting on courses? I know you've got some books.
Yeah, I have at least 3 books, and if you count chapters and other books, a little bit more. And I do teach courses. I specifically teach a course, the Hepatitis C Professional Certification, for practitioners to be able to integrate with Western medicine. But I also do lots of teaching at many conferences. I'm especially interested in herbal in teaching people how to do research in herbal medicine.
Okay.
And I'm on the board of the Society for Acupuncture Research.
Okay. So, and you mentioned there being a lot of, I'm from Vancouver, a high incidence of hepatitis C there, so maybe coming up there to teach some of our practitioners would be beneficial, yeah.
Especially since it's a sister city with San Francisco.
There you go, exactly, yes, we're bonding.
Yeah.
I want you, before you go, I know there Sharon Weisenbaum is speaking, and I know you want to see that. We were talking in the lobby, and funny, I mean, we were speaking to John O'Connor before, and small world.
Yeah.
Tell the story to the people about you moving to New York and starting to practice Chinese medicine.
When I moved to New York City, I moved as a journalist, and I moved to work at a place called Liberation News Service in the mid-1970s. Right. But when I went to live in my new apartment, or in my room, in the Upper West Side of New York, you know, every day I looked at the little tag that was on the door, and it said Ted Kapchuk. And I said, I don't know who that guy is. You know, and it's like, and then I lived there for several months, and finally I found out later who Ted Kapchuk was. And actually I told him this a while later, and he thought that was hysterical. So I decided that everybody who goes through that room, you know, I wonder how many Chinese medicine practitioners came out of there.
That's so awesome. It's such a small world. I mean, it's great.
Yeah.
It's great to be able to chat with you, and if you are ever coming up to Vancouver, be sure and let Chinese Medicine Tools know, because we'll help fill your conference, or maybe Prodi will help you get there.
Yeah, I think
anyway,
we discussed it.
It was definitely my pleasure.
Yeah.
Thanks, Misha.
Nice to meet you.